Welcome to this webinar, the importance of maternal movement in labour for optimal fetal positioning. Basically, we're going to go through why you should be moving around during your labour and what sorts of positions you should be using to help your baby get into the best position to be born. True story, when I first gave birth to my children, I didn't know that I could move around during labour. I had a monitoring system on me, so I was confined to lying in a bed on my back. And I firmly believe that this did not help me have a quick, easy, or comfortable labour. Looking back, I wish I had learnt this material that we're going to cover so that I could have moved around and helped my baby be born. So we're going to go through lots of useful information, and I encourage you to practice this throughout your pregnancy as you prepare for your upcoming labour. As you approach the end of your pregnancy, you'll already be familiar with your baby's movements inside your womb. But did you know that your baby could be changing positions during labour from your first contractions until right before your baby is born? The movements you make during labour can help your baby rotate inside your body, which can make a big difference in the length of your labour and your level of comfort. Changing positions and using rhythmic movement can also help speed up a slow labour and increases the likelihood of having a vaginal birth instead of an unplanned caesarean birth. So in this webinar, we're going to go through a variety of positions you can use during labour to help your baby move into an optimal position for labour and birth. Before your labour begins, it's helpful for you to understand the main fetal positions during pregnancy and labour. The anterior position is the most common position for babies to be in at birth. So anterior means that your baby is head down, facing your back, like in the image. You may hear your healthcare provider describe this position as occiput anterior or OA. Fetal positions are described in terms of the back of your baby's head, which is called occiput. The anterior position is ideal for labour because in most cases it's going to provide the best fit for your baby's head in your pelvis, and it's going to allow the head to descend more easily. This can make your labour progress more quickly and be less painful. The anterior position makes it easier for your baby to tuck under your pubic bone and lift his or her chin when your baby feels the pelvic floor, allowing for a smooth birth of your baby's head. If your baby is head down and facing your front, he or she is in the posterior position, which is sometimes called the occiput posterior or OP. Your baby's head doesn't fit into the pelvis as well in this position, and if his or her head can't descend low enough to press on your cervix, labour progress may be delayed. Now, although the posterior position presents more challenges, babies who are in this or other less than ideal positions near birth can still be born vaginally, but labour may last longer and be more uncomfortable for you, the mother. Sometimes babies are sideways in the uterus, which is called a transverse presentation. So this presentation is common during early pregnancy, but it's rare at the end of pregnancy. If your baby is transverse during labour and doesn't turn head down, he or she won't be able to fit into your pelvis, which is going to result in a caesarean birth. Breech presentation is when your baby is positioned feet or buttocks down in the uterus. So you can see that in the image there. Like transverse, this presentation is common during early pregnancy, but most babies do turn from breech to head down before the end of the third trimester. If your baby is still in a breech presentation at the end of your third trimester, your healthcare provider will present several options to you. One of those is that he or she may attempt to turn your baby manually prior to delivery, and this is called an external version. Let's go through some labour positions you can use for the first stage of labour. So the first stage of labour begins with early contractions and ends with complete dilation of your cervix. You probably won't know how your baby is positioned during labour, but if your baby is already in an optimal position, the maternal position changes suggested in this webinar won't move your baby into a less desirable position. Now, it's helpful to change positions every 30 minutes during labour, so switching from being restful to being active. If you find that a certain position or movement feels better than others and your labour continues to progress, you can stay in that position for as long as you like. Don't use a position if it doesn't feel right or if your baby's heart rate decreases as you're using it. The first group of positions we'll go through are your upright positions, which include walking, abdominal lifting, and sitting. So upright positions are going to use gravity to move your baby into your pelvis and rotate him or her into an interior position. So that's the most optimal position to be born in. Upright positions help your baby descend low enough that his or her head can press against your cervix, causing it to dilate more quickly. This can make contractions more efficient and speed up your labour. Additionally, using movement in upright positions such as slow dancing with your partner, walking or sitting on a birth ball changes the shape of your pelvis slightly, and this can help your baby move into a more favourable position. Now, walking is also beneficial because it provides a change of scenery and gets you out of the hospital room, and it can also boost your confidence during labour. Let's look now at abdominal lifting. So abdominal lifting can help your baby's rotation and progress your labour, as well as alleviate pain in your back or your groin area. So to do an abdominal lift during labour, you're going to place your hands below your belly, you're going to bend at the knees slightly, and you're going to gently lift your belly when a contraction begins. Then, when the contraction is over, you're going to lean forward slightly and gently let go. Try doing these abdominal lifts from the beginning to the end of several contractions in a row. Let's look now at sitting positions for during labour. So sitting upright on a bed or chair is a really good resting position that still offers some gravity advantage to help your baby align properly and descend into the pelvis. So you want to sit straight and you want to maybe look at arranging some pillows around you for comfort. If you sit on the edge of a straight chair or birth ball, which are available at many hospitals, make sure that you keep your knees lower than your hips to give your baby more room to rotate. Let's look now at forward leaning positions. So forward leaning positions include sitting, standing, and rocking on all fours on your hands and knees. Like upright positions, forward leaning uses gravity, which is going to help your baby turn and align properly, and as well it's going to ease any back pain that you might have. If you're sitting, you can also try leaning forward and resting your upper body against a bed, the back of your chair, or another sturdy surface. You can also sit on the toilet facing the wrong way, and you can lean your hands up onto the back of the toilet. And when we're on the toilet, obviously we're used to letting go, so a lot of women do find sitting on the toilet a great position for during labour. It's going to also help opening up that pelvis because you're almost in a squat position. Let's look now at moving around during labour. Many women find rhythmic movement relaxing during labour. Movement can be applied to most of the positions that we'll go through in this webinar. Experiment with a variety of rocking or swaying motions until you find some that feel better for you than others. The forward-leaning positions also present a really good opportunity for your support person to provide a back massage or other comfort measures. If you're standing, you can lean against a raised bed, a birth ball that's placed on the bed, or on another sturdy surface. One useful active position is to support your weight on all fours on your hands and knees, or kneel with your upper body on a birth ball, and then you can rock your pelvis back and forth, side to side, circles, figures of 8. The position of your body and the rocking movement is going to use gravity to help your baby move. It can also relieve back pain and progress a slow labour. Supporting your weight on your knees can become uncomfortable, so make sure that you're kneeling on a pillow. If the hands and knees position or kneeling over the ball feels right, use them during contractions, and then you can rest in between contractions. So try this pattern for about half an hour or more, or whatever feels most comfortable for you. Asymmetrical positions include standing lunges, kneeling lunges, and stair climbing, and they can be especially helpful when labour isn't progressing. Asymmetrical means that the legs are placed in different positions, such as having one leg up and the other leg down, which opens one side of the pelvis more than the other. So to do a standing lunge, you want to stabilize a chair or footstool so that they won't slide, and place it to your side and make sure that you have good traction under your feet so you're not going to slip. You're going to stand upright with one foot on the chair and lunge over that raised knee until you feel a stretch in both your thighs. And you can shift your weight back in an upright position and repeat. Lunges can also be done in a kneeling position on a bed. It's a good idea to try lunging on both sides and do more on the side that feels best for you. You will need a support person to help you maintain balance if you do any lunges. Another basic asymmetrical position is to stair climb, which should be done with a support person nearby and with the use of a handrail, of course, for safety. One of the best positions to try if you're tired or if you've had an epidural is side lying. This is very restful and can help your baby rotate. A side lying position can make it easier for your baby to turn as you're resting. So to do a side lying position, you're going to lie on your right or left side with a pillow under your top knee for support. You can see that in the image there. You may prefer to roll over onto your chest with your upper knees drawn up towards you, keeping the pillow under your knee for support. Consider alternating side lying positions with other positions for 30 minutes at a time to help your baby rotate during labour and birth. So really, we want to keep moving in and out of different positions during labour rather than just being in one position. During labour and birth, you may have some constraints on when and where you can move. Now, in the hospital, you may have 2 monitors on your belly, which monitor the fetal heart rate and your contractions. So you can see that there in the image. These monitors may be used for part or all of your labour, depending on the circumstances. Position changes and movements are still possible during fetal monitoring, including walking. Ask if a wireless fetal monitor is available, which you can take in the hallways or around the room that you're in. It's also common for many women to get fluids through an IV, which might again inhibit your movement. Now, IV poles with wheels are available, which will help you to change positions in bed, walk around, or sit on a chair or a birth ball. So there's some options for you to continue moving even if you've got some constraints. So that covers positions that you can use during labour for the first stage of labour. So there are a wide variety of positions that you can try during this first stage of labour. So upright positions, including walking, your abdominal lifting and sitting. As we've discussed, these positions use gravity to help move your baby into an anterior position and descend to be born. They can also provide a change of scenery, progress your labour, and help ease any back pain. Then you've got those forward-leaning positions, including sitting, standing, and on all fours on your hands and knees. Again, these positions also use gravity to help your baby rotate. They also relieve back pain, and they also progress a labour that has slowed down. Asymmetrical positions include your standing lunges, your kneeling lunges, and stair climbing. These are going to open up just one side of your pelvis to help your baby rotate, and they provide a gravity advantage. And again, they're going to help progress your labour. Sideline positions are good to try when you're tired, in between contractions, or if you've had an epidural. So side lying is very restful and can be alternated with other positions to help your baby rotate. Let's go through movements for the second stage of labour now. So the second stage of labour includes pushing and the birth of your baby. Positions for the second stage include sitting, on all fours, on hands and knees, squatting, and side lying. Now, it's important to have a nurse or healthcare provider present when you're pushing. Semi-sitting and sitting upright are good positions to consider for the second stage of labour. They're going to offer more gravity advantage than lying on your back, and they may provide a little more room for your baby to rotate. However, semi-sitting or sitting upright may not always give babies enough room to rotate and descend, so consider pushing in various different positions. Being on all fours on your hands and knees can also be used for pushing. Again, it's going to use gravity to rotate your baby and help to reduce back pain. You can modify this position by leaning on the back of the bed. You can see that in the image there, using a squat bar or over a birth ball. Squatting positions are helpful during the second stage of labour because they can help your baby rotate. They're going to give a gravity advantage and they're going to increase the space in your pelvis and really open that area up. With your feet flat on the floor or a sturdy section of the bed, you can lower yourself into a squatting position with the help of your birth companion or your partner. Now, your birth companion should keep one foot in front of the other to help keep their own balance. You can also use a squatting bar for support, which is a piece of equipment that can be attached to your bed and is available in most hospitals. So you can see that there in the image, she's leaning over that squat bar. It's best to try squatting after your cervix has dilated to 10 centimeters and to wait until you have that urge to push. Squat during your contractions and then sit back when they're over to help conserve your energy. A toilet or a birth stool, if available, can support your squat, and this can save you valuable energy. Shift to another position after you've tried squatting 4 or 5 times in a row. Side lying is also a good position for pushing, and it's possible to do as well if you've had an epidural. So if you're tired, this restful position is going to help you save your energy for pushing, and it still leaves enough room for your baby to rotate. In the side lying position, you can lie on your right or your left side or alternate between the two. Your legs will need to be far enough apart that the baby can actually come out. So your upper leg will be supported by a leg rest that's attached to your hospital bed or by a support person. Let's talk about lying on your back during labour. Lying on your back is a position that is less than ideal during the second stage of labour. When you're flat on your back, your baby has less room to rotate, which can give you more back pain and prevent your baby from rotating into an anterior position if he or she is posterior. It may also provide less oxygen for your baby, and the lack of gravity advantage may make it more difficult for you to push your baby out. Your healthcare provider may prefer that you be on your back when your baby is born. If so, you can probably try other positions until your baby's head starts to crown. That's until your baby's head is visible and ready to come out. So in summary, there are many alternatives to lying flat on your back during the second stage of labour. Semi-sitting and sitting upright, they're going to offer some gravity advantage and provide a little more room for your baby to rotate as you push. Being on all fours on your hands and knees has a gravity advantage and can help reduce back pain. Squatting positions have a significant gravity advantage. They assist your baby's rotation and they increase the space in your pelvis to help your baby descend. Side lying positions are restful and give your baby enough room to rotate. It's also possible to push in a side lying position if you've had an epidural. So I want you to practice the positions you've learned about in this webinar at home with your support person or your birth companion. Become familiar with them now because this is going to make it easier for you to try them during labour. The positions you've learned about in this webinar are going to help you focus, cope with any discomfort during labour, and help your baby move into an optimal position for birth. The most important thing to remember is that your body already knows how to give birth, and your instincts will help you find positions and movements that are best for you and your baby during labour. Thank you so much for joining this webinar. Get active during your pregnancy, move your body, prepare your body for labour, and good luck.